Institute. It is now December 23rd, 2021, and we're going to be performing two procedures today. The first one is a cervical Deuk laser disc repair. The Deuk laser disc repair is a surgery that's been peer-reviewed and published in the National Library of Medicine as safe and effective for the treatment of painful, symptomatic cervical disc herniations, bulging discs, and degenerated discs. The Deuk laser disc repair is an endoscopic type surgery where basically we go in with a tiny incision and use a little tube and an endoscope to find the problematic area in the back of the disc. And the problematic area in the back of the disc, if you want to understand the anatomy of the spine so you understand what a disc is, there are bones in your spine. Between these bones is a cushion because the bones actually move. And you don't want hard bones grinding on each other because they'll wear each other down over your lifetime. So we have a cushion between the bones, and that cushion is made up of two parts. It has actually a very tough outer shell, or it's not made out of shell-like material, but it's very fibrous, and we call it the annulus fibrosus. There's a jelly center called the nucleus pulposus. When you get a tear, you get a piece of the jelly that squeezes out through the tear, and that's what you're seeing here. It's called a herniation. Now, surgeons who do fusion surgery like anterior cervical discectomy and fusion, to get to this herniation in the back of the disc, they're going to take your entire disc out. And when they take your entire disc out, let me just show you what that looks like. When you take the disc out, there's nothing in between the bones but space. So those surgeons have to put a cage that's solid. It's made out of PEEK, which is polyether ether ketone. It's a synthetic carbon. Or they put metal, or they'll put cadaver bone, like a dead person's shin bone that's been milled and cut and sized to fit in there. So who wants a cage or a piece of titanium or cadaver bone in your spine? I don't. The Koreans developed a technology where instead of taking the disc out, they actually pass through the disc to get to the herniation in the back, okay? And that's in the cervical spine. So you can see the herniations back here. Instead of taking the whole disc out, the South Koreans went through and basically used an endoscope to remove the herniation back here and then come out and leave the front of the disc alone. So there's no need to perform a fusion with a metal plate and screws, and there's no need to put a cage in there. There's also no need to put an artificial disc. So this is advanced technology. This is state-of-the-art type surgery that's only found in a few places in the world. Deuk Spine Institute is the world leader in endoscopic spine surgery. We perform endoscopic spine surgery on the neck, the thoracic, and the lower back. We're one of the only places in the world that do all three parts of the spine, if not the only place. And we have experience in the thousands of surgeries. We have 0 complications to date with the actual surgery itself in over 1,400 surgeries for the last 15 years. So this surgery that we're going to be doing today is cervical endoscopic spine surgery. I'll be going in through the front of the neck. I'll make a small incision, and I'm going to remove a herniation in the back of the disc that's pressing on this patient's nerve. This patient's left arm is going dead. He's got almost no strength in the left arm. Unfortunately, he's waited too long for the surgery, to be quite honest, but it's only going to get worse if he doesn't get the surgery done. So I'm going to go in and decompress the nerve root. Now, he does have more than one herniated disc, but he only wants the one disc fixed today. So we're only going to be fixing one of the 2 discs that actually need to be fixed. He's aware that there are 2 discs that need to be fixed, but he's chosen just to do the 1 disc. So without further ado, I'll head into the operating room and I'll rejoin you in about 5 to 10 minutes. In the meantime, we'll run some video footage. And remember, Deuk Spine Institute has a YouTube channel with all of our videos. Also, there are many videos that are still not on the YouTube channel that have not been indexed on our YouTube channel that you can find on YouTube. We're going to live stream on Facebook and Twitter, YouTube, and LinkedIn. So if you're watching on any of those platforms, you could watch our surgery live this morning. Again, this is a endoscopic cervical spine surgery for a herniated disc at C6-7 in a patient whose arm, in the left arm, is going dead, basically, and he has no strength in the arm. Talk to you soon. I'm Dr. Ara Deukmedjian. I have a very special patient sitting here next to me who's traveled all the way from Tennessee.
Yes, sir.
With his family for one purpose, and that is to get his neck fixed.
In the wild, I've trained animals for 25 years, not jumping through fiery hoops, but just mostly behavior, no, come is, just a few words. We had 52 big cats, tigers, lions, leopards, cougars, lynx. This is me about 6 years ago in the tiger cage. And this guy here, we raised him from a baby.
That's special.
I'll tell you what, the special part is being here.
And how long have you been dealing with this problem with your neck?
It's come on in the last 8 weeks strong, but after I start thinking about it, even 6 months ago, I was seeing things happen that I couldn't understand why. And I just want to get back to somewhat where I was at and get the feeling back in my hands, my stability, a little strength where I can get this boy up.
Well, what's going on, as we've talked about, is you've got these herniated discs, bone spurs in your neck that are pinching down on your spinal cord and nerves. And I'm going to go in there tomorrow with a laser, and we're going to open all those spaces up, get the pressure off the spinal cord and the nerves, so you can start getting some feeling back and strength back in those arms.
That sounds great. That's why I'm here. Then I've researched, and I kept coming back to you all and seeing the testimonies and seeing, watching hour after hour after hour of the surgery. And that, that says a lot if you can do it live on Facebook. It's just a pleasure to be here. I feel safe. I feel like when we arrived last night, we drove up in front of the place, and I told my crew and my wife and my driver, I said, we have arrived. We have arrived. Thank you so much.
We'll see you tomorrow morning, all right?
I appreciate it so much.
So we did surgery yesterday with the laser. Everything went really well. You can actually see the 4mm incision right there, 3 discs. He didn't want fusion, and so he found Deuk Spine Institute and he came here.
After the surgery, when I talked to her, I was still a little bit drowsy. And 4 hours later, we were sitting over at a restaurant, seafood restaurant, eating seafood, and I could clap my hands at the baby because he claps when he does something good. And I could clap with him without missing my hands.
And you're already getting strength back in your arms and legs. You're getting control of your bowel and bladder back again. That's great news. It's a great sign. I think you're going to keep improving and hopefully get you back to normal.
You are the best. That's why I'm here. That is why I'm here. It is amazing. For the time I walked into this place, I felt at home. I felt like I was with friends all the way through surgery. When we walk into this surgical room, everything's so clean. I feel like I'm in a dream. I really do. Thank you so very much for what you've done.
You are welcome.
Hello everyone, welcome to the Deuk Spine Institute surgery stream here on the Deuk Spine app on the YouTube channel and our Facebook page. Dr. Deuk is headed towards the operating room and he will be operating on a patient's cervical neck, doing his world famous Deuk laser disc repair. Meanwhile, we'll leave you guys with more testimonial videos about how great this surgery really is. It's helped thousands of patients. And thank you very much for tuning in.
Let's get started. I'm Dr. Deukmedjian. We're here with one of our patients who traveled here from Texas, correct?
No, Auburn, Alabama.
Sorry, Alabama. All right, so Alabama. And why did you come to Deuk Spine Institute?
Because the last flare-up of L4 that ruptured in 1999 was unbearable, and my wife can be a testament to that. Who took care of me for 10 days, crying on the floor with an amazing, incredible pain.
Okay. And you've had that pain now in your lower back for 22 years?
Yes.
You've tried physical therapy and exercises, stretching, but none of those things worked?
Nope, temporarily.
Yeah, and where was your pain coming from? Do you know?
It was around the belt region in the back. Yeah.
So the L4-5 and L5-S1 discs had tears and they had inflammation and pain. He also had sacroiliac joint inflammation and pain. And Dr. Patel standing here, which we don't get to see you very often, but Dr. Patel was a hero. He came in and did the bilateral SI joint injection.
Yep.
So do you still have the pain in your back that you came here with?
No.
It's gone.
It's very, very gone. Yes.
Excellent. Well, it should stay gone. Is there anything you want to say to your audience?
Well, I think more people should come and start looking at this procedure, finding the website, learning about what are the things that needs to be done, such as sending the MRI, and trust on the incredible treatment and experience that I have received from this team. It's relatively impressive, very impressive, and I would recommend it to many of my friends who play golf and has been suffering for a long time.
All right, very good. Well, have a safe trip home.
Thank you, sir.
Finally, this is 1 hour after my procedure, and I am walking just fine. I'm gonna turn, very stiff, and then I'm gonna walk around, and so far so good. I feel very, very pleased. 24 hours after the procedure was performed on me on L4, L5, and S1, the L4 injury has been there for 21 years and has never give up and has made my life miserable. And the initial injury occurred because I have congenital issues inherited from my father, who suffered tremendous sciatic pains, and all my five brothers also have the same issues. So this is only 24 hours after. I already walked a mile this morning, and I only have taken 1/3 of the indicated medications, and I still have no pain, with considerable improvement over 3 or 4 major landmarks. The first one is pain down the leg, the right leg, where the main injury occurred, as well as pain on the left and the middle of the back for the 2 main new discs that were also injured, the L5 and the S1. So I recommend this procedure to anyone who, like me, has suffered for many years and were afraid to the pain that is inflicted with some other technologies that basically requires months for rehab. And I will not hesitate to submit myself to another procedure if it's needed, Dr. Deuk's Spine Institute. So I thank everybody for all the service, outstanding service, medical and social.
Movement by not fusing, and we don't put
Hello everyone, thank you again for tuning in to the Deuk Spine Institute live stream for this surgery. Dr. Deuk is still heading over to the OR. Meanwhile, we'll leave you guys with some more testimonial videos of past patients and how their results have gone thanks to the Deuk Spine Institute.
movement. Not too hard, not too hard. It's pulling the needle.
Are you okay? I can't believe, how are you walking around and you look so comfortable? And I tell them, I don't have anything in me. And I tell them how the surgery went, and I don't mind showing them the video, and they're blown away. And so I often share your website and number with many people.
Thank you. Dr. Deukmedjian here with one of my patients who actually happens to be a musician, and is here in the local high school, right? A very large high school for that matter.
Yep, absolutely. The largest in the district.
Largest in the district. And you have how many members in the band?
160.
160 students in the band, and he is the director of that program. Tell me about your back problems before we did your surgery.
I was an active runner and exerciser, and I was out, on a very long run, 15K, and I noticed a pain running down my leg. I thought it was due to poor stretching and not enough stretching, so I increased that. It wasn't going away, which was a red flag indicator, and I saw my doctor, who then recommended an MRI to see what was going on. And it showed the herniated discs, the L4, L5, L5, S1, who then recommended me to go to another center to receive back surgery. To which, and I had told you before, my wife saved the day and found you guys.
They usually do. The wives usually do. They keep us out of trouble.
Yes, she often does. So, when I came to see you with that same problem, with the pain shooting down my leg, I would say at days, 9 out of 10, I would have to call off of work, sit at home, or lay at home, honestly, just to stay off of it because the pain was so great.
Yeah.
Yeah.
So it really had, the pain in your back and down your leg had a really bad effect on the quality of your life and your ability to do your job. And what did the other center, by the way, what did they recommend in terms of treatment for you?
A fusion.
A fusion, right?
Yes.
So you didn't want a fusion.
Absolutely
You didn't want
not.
a fusion. You didn't want to lose the natural movement from your lower back. And you found out, your wife found out about our laser surgery, which preserves movement by not fusing. And we don't put anything in your body and leave anything in there. So your back pain that you had before surgery, which was done 6 weeks ago, by the way, how much of that pain do you still have?
0.
Gone.
0.
Cured.
Yes.
Awesome. And the leg pain?
It is gone. Yeah, the pain shooting down my leg has completely gone away, and it is wonderful to be able to climb the bleachers in the stadium, to get on my podium, and to be able to play my saxophone comfortably.
Awesome. Well, congratulations. You had the courage to do the surgery and have the laser surgery repair your disc, and here you are 6 weeks later doing fantastic. Please tell your wife, give her my best regards. Okay?
Thank you so much.
All right. All right, Dr. Deukmedjian, we're just starting to gain access to the front of the spine for a Deuk laser disc repair. We're sitting on a bone spur that's just in the front of the spine with my needle. Normally I'm inside the disc at this point, but I'm gonna have to try to, don't do anything, just hand me the dilator. I'm gonna have to try to bring the dilator down. Let's get an AP. Nobody move. It's a little bit of a tricky situation because, well, quite frankly, the patient's is a C6-7 disc, which is very hard to get to. I need a quick AP. Move your hand, please. Looks good. Lateral. We are on the front of the spine in the center where I want to be, but we're just on a bone spur sitting over the disc from the top, which is C6. So it's growing off the front of the spine at the bottom of C6 over the disc. And I'm sitting on that bone spur right now. And I cannot get through it with a needle. But what I can do is I can manipulate the dilator. So I'm going to bring the dilator down to the spine. The dilator is hard and strong. And as long as I keep this guide wire planted on the spine, it's safe to bring the dilator down. The dilator will sit right on the bone spur, and then I can maneuver the dilator. I think I'm there. Shot. Looks good. I do this manipulation all the time, but usually after I do my first disc. And then I move the dilator around the spine. All right, so we're gonna need, where are you getting?
I need the other needle because after you.
Let's get an AP. I don't know what you're saying.
You want a discogram after that,
I
right?
want to do a discogram.
Yeah, so we need
So you
the
need
other
the skinny needle.
Yes, yeah.
All right, so you're saying the other one won't fit in here.
Correct. Yeah.
You want to hold that? So to summarize, because this patient's anatomy is a bit unique, that looks good. Go back to a lateral. I now have the dilator tip right in the center of the spine. I just need to get it over the soft part of the front of the disc where there's no bone spur. And then I can enter the disc. And to do that, his shoulders are absolutely huge. They're blocking the x-ray. They're making it very difficult to see anything. So what I'm going to do is I'm going to have to use this x-ray to maneuver on the lateral view. And let's get a shot. That looks pretty good. If you can improve that a little bit, just a little bit. Yeah, you can see we're literally sitting on a bone spur that's right over the disc. So I'm going to take my guide wire out and I'm going to move. And I need your help, Luis. I need to move this south. So you're going to have to
Yes, sir.
give me your best shoulder pull, head pull.
There you go.
Nice. There we go. Shot. There it is. That's it. We're there. All right, everybody relax, relax. Now I need an AP to make sure we're still in the middle. We haven't really started the endoscopic part of the surgery. We're trying to get down to the spine and gain access to that disc. As long as we're in the middle, which we are, we can move forward. We're good. Nice work, mallet. So now I'm going to advance. I'm underneath the bone spur. I'm going to advance my dilator into the disc, and I feel it moving already, which is a good sign. So I will need another shoulder pull. Guys, I need the head stabilized, otherwise you'll just pull the whole body south.
Yep.
Hey, that's perfect right there. Nice. So I'm angling up, and I'm going to advance the dilator into this C6-7 disc space. Shot. C6-7 is the hardest disc to get to. And especially in people with big shoulders. We're pretty much there. I didn't get to do my discogram, so I'm going to pull it back just a little bit. And I don't know what we'll get a discogram. We could try. Let's get some shoulder again. And I'm going to try to no, just hold on, let me see. Shot. Yeah, you know, we're not going to get the discogram done.
Okay.
Let's just move forward.
Okay.
That looks really good. We're at the back of the disc with the dilator. I'm just going to go another millimeter. So I did something unique here that I've not done in terms of specific technique. I was not able to gain access with the first disc with the needle because of the bone spur and the fact that the disc is so low and the shoulders are so big that visibility is somewhat poor but adequate. But I did get the needle just on a bone spur over the disc in the front of the disc, and I was able to then bring down the guide wire and the dilator after making an incision, and now we're inside the disc we need to fix. Let's just verify that. I want to make sure it's C6-7. No, lateral. A zoomed out lateral. Not terribly zoomed out. I still need to see this disc, or at least the C6 bone. Shot. I need to see C2. You need to show me C2. So the dilator looks perfect. Further north, a little less exposure. So 2, 3, 4, 5, 6, 7. All right, that's good. That's good. Yeah, no, you're fine. I think we're fine here. You can see the bottom of the skull, you can see the C2 bone, and you got 3, 4, 5, 6, 7. And we're doing C6-7. So we're at the right disc. We just verified that, which we knew, but we wanted to make absolutely sure before we start doing our discectomy or Deuk laser disc repair. All right, I'm just bringing the tube down now over the dilator. So I will need to see you, I will need you back down at some point, and I'm on front of the spine. So I'll need a shoulder pull, I'll manage all of this, and I'll need a head pull, inline traction. What? I just need a shot. I don't know what you're talking about. That's it right there? All right. Shot. You watch the tip, Luis, make sure it doesn't advance. Shot. 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 Pretty much there. Shot. That's good. All right, so we're where we need to be with the tube. I know it's hard for you all to see that. That's going to be hard to get out. Good job, Luis. Okay, we are, they say better to be lucky than good, right? We've lost half a drop of blood, half a drop. Now this patient's other option would have been an anterior cervical discectomy and fusion. He has a degenerated disc, you could see it on the MRI. He has a herniated disc, degenerated disc, spinal stenosis, pinched nerve, radiculopathy, weakness from a result from the pinched nerve in his left arm. So we now have him asleep under general anesthesia, muscle relaxed. We've just gotten into the disc that we're going to fix. And like I told him before, he has 2 discs that need to be fixed, 5, 6, and 6, 7. He's only doing 6, 7. That was his choice, just to do one. And so far, so good.
The pedal is in the right place.
C6-7 is pretty much the lowest disc that we can access through the front of the spine. But rarely are there ever disc herniations below that at C7-T1 that we would ever need to treat, because that part of the spine is pretty stable. But I do see from time to time. There is a way to get to C7-T1 through the back, transforaminal, which we actually have one patient we've recommended that for. I don't know if they're going to have the surgery done or not, but I've made that recommendation, so we may see them sooner or later. Start the irrigation. All right. Let's show everybody this rig that we use. Can you see the rig, Diego? The endoscopic rig.
Yes.
You all see this?
Yes, we see it.
So the rig has several parts. It has a camera that actually looks right here at the back of the lens system. We have a fiber optic scope here. We have a light source here that produces light. We have irrigation that sends water down to the end, so we have constant cold irrigation. We have a laser fiber here that goes in through this, we call this a port. So this scope has 3 ports, 1, 2, 3. And this is the scope that I've been using for 15 years to do all my cervical spine surgery. And it's wonderful. How are we doing over there, guys? So the scope is down. Do we have to white balance?
We have to white balance right now.
How come we haven't? This is like the second time this has happened. What's going on? Normally you white balance. What's the problem? Why are we having this, Luis? Is there a software issue? Is it a human error? Is it a machine error? What is the error?
Can you turn off that and revive again, please?
Luis, is it just it was forgotten to do, or? Oh, okay, all right.
Turn off, please.
I didn't know if we were having a problem with the hardware.
Camera is completely on. There you go. That's perfect. There you go.
All right, so you're gonna have to white balance. Go ahead, but you don't want the red light from the laser. Turn the targeting beam off on the laser. Do you know how to do that? If you don't know how to do it, don't do it. There it goes. It's off. Oh, no, it's on. It's off. Keep it off. Wait, is it off?
I got it in my hand.
No problem. Yeah, you just don't want red light during a white balance.
Monitor. All right, good. Thank you. Thank you very much. Thank you.
All right, so we just had to white balance our camera. What that means is we're telling the camera what the color white is. That way it gets all the colors right during the surgery. Remember, its camera is a digital system. So it's taking an image and then digitalizing it and then rebroadcasting or projecting it. So if the camera system doesn't know what white looks like because you haven't told it, then it could make some really weird colors. So we have to tell the camera what white is. We call that white balancing. Pretty standard for endoscopic spine surgery. All right, we're heading down the bottom of the scope. Here's where the herniation is. Huh, interesting.
No, just, yeah.
I want zoom. There we go, that's better. All right, so I zoomed in a little bit. Now I got to focus the camera. And, you know, there's very little light for some reason. It just seems so dim. I would increase the brightness a little bit. Maybe 1 or 2. Doesn't seem to be increased. It's not really increasing the brightness.
And then over here, yeah, increase it right now. Oh, yeah, go on.
I'm not sure why. Any ideas, Luis? Let me see. That's strange. I can't even get the zoom or the brightness. All right, that's fine. Let me grab some of that herniation. Now remember, we don't have the blue stain today. Because I couldn't put the needle in first and then do the discogram, we don't have our blue dye.
It's the same thing, yes. Yeah, we don't change it. Yes, sir. Yes, please. Thank you very much.
All right, get the irrigation on. So we can still do the surgery without doing the discogram, but this is all fragments of herniated disc. The laser is pushing backwards. The laser fiber is at 12 o'clock on your screen, and that's all calcified herniated disc right there. Look at the golden color. The golden color is calcium or bone spur, basically. A lot of calcium. That's good, guys. I don't need that any closer. Yep, I don't need it any closer. You can see the herniation here. The laser's literally peeling it off. And there's not a lot of movement of the disc right in the beginning, but there will be more later once we use the laser to free up and debride the annular tear. We're going to free up the segment. The laser really works by delivering energy directly to tissues. I'm going to flip it around. And just to be able to mobilize things, you've really got to go back and forth. So you're going to see me flipping the laser around and using it back and forth. Meanwhile, I'm putting some pressure on the tube. This is actually pushing on the nerve and spinal cord. So I have to remove it using the laser. Again, you're gonna, oh, there's a herniation right there. You guys see that herniation just slip out? That is sitting on the nerve root. Now it's out into the disc space. We call that a reverse herniation. I coined the term the first time ever used, called the reverse herniation. And the reason you can see a reverse herniation is because we're inside the disc with the scope. You're actually looking at the back of the disc right now, where the nerves and spinal cord are, right through that little gap. So that's where the reverse herniation came from. It was actually sitting on the nerve and the spinal cord. Okay? So I'm going to keep working this for the next 15 minutes or so. And these are bone spurs here that I'm removing with the laser. Typically, I remove bone spurs that... Do we have a lot of these working cannula?
Yeah, yes, sir.
Good. I want to make sure we have plenty of them. I'm just going to... This is all scar tissue right here. This is like literally holding the bones, C6 and C7, keeping them from moving. Bone spur. Any questions from our audience?
Yes, Dr. Deuk, we have our first question from Facebook.
It's a little bit light on the voice, on your volume.
Can you hear me better now?
A little better.
Okay.
Yeah, thanks, Diego.
Yeah, no worries. Yes, our first question comes from Facebook. They want to know, when Dr. Deuk reviews MRIs, is he happy with just images?
Okay, so when I review MRIs, am I happy with just images? So I make most of my decisions based on the images. I need to see as many images as possible. Some people like to take a picture of one or two and then they send it to me and say, what's wrong? What do I need done? Very hard for me to make a determination on just one or two images. I need the entire DICOM set, which is all the images. So I prefer all the images in DICOM format, which is, you could send it on a CD or you could upload it yourself if you have a CD reader, okay? And then I like the reports because, you know, sometimes the radiologist will see something that I didn't see. It's not often, but that can happen. And it's very, very good for me to have the radiologist interpretation as well. Mostly what I'm looking for with the radiologist is like tumors or infections, weird stuff that is not normally present. You know, I'm used to looking at stenosis and herniated disc, degenerated disc. Of course, I could see a tumor infection normally. But if there's some edema and swelling, I want to know if the radiologist thinks that that's a tumor or an infection. So I like to get the report along with the MRI so that I can understand what the radiologist is seeing as well. So the perfect MRI review for me, I have some history from the patient. Like, all right, they have neck pain, they have right arm pain, they got weakness. I have the MRI images, the T1 and, the T2 weighted sagittal and axial images particularly, and they were loaded on DICOM. The reason DICOM is important is because we have a special computer program that allows us to look at DICOM images called the PACS system. And the PACS system lets me manipulate the images, measure things, and it gives me the ability to really look critically at an MRI and scroll through it in the way I like to look at it in detail. I'll look at a set of images, scrolling through them on the PACS system. If they're DICOM loaded images, I'll look at that like 15 times, you know, each area, that's especially the bad areas. So the ideal world, I have a little history, which is why we have a history form you have to fill out. I have the radiology report and I have the DICOM images, okay? That's the ideal situation for me, to help people figure out what's wrong and how to fix them. A lot of scar tissue here. That's a piece of herniation right there. The uncinate process there. Let's go back the other way. Is that our only question so far?
We just received another question. It's about what company do you use for your laser?
The company we use for our laser is called Lumen. What is it called? Luminous. We use the VersaPulse Power Suite. VersaPulse, VERSA Pulse Power Suite. And this is a holmium YAG laser, medical laser. It's a 100-watt laser. We never use 100 watts. But it's their top of the line laser. And why don't you, if you can, without giving away any patient information, why don't you show the audience the laser if you want?
Okay. It's by Flynn, right?
Yeah.
All right. Yep, they're seeing it.
A lot of this herniation is so bad. Tons of scar tissue right here that I'm dealing with. And this is all from the herniation itself. Herniations cause scar tissue because they cause inflammation. Inflammation produces scar tissue. That's where scar tissue comes from. Most people don't know that. It comes from inflammation. So that's where people get all this scar tissue. And that's a lot of, oh, look at that herniation that just came out. That's awesome. Okay, good. Did you guys see the laser?
Yes.
Yeah, show them the laser.
Yeah,
Turn a little bit to the left. There you go. That big machine is our laser. There's no patient information on there, yeah. So, yep. All right, good. Now you know. That is a very expensive piece of equipment, by the way. I went the first 12 years, 13 years without buying a laser because they're so expensive. And then I bought one because the problem was the company we were using, it was so hard to get them to come when we needed them. And we were getting busier, so we decided just to buy our own laser. All right. Let's go back the other way. So I'm going back and forth, side to side, and what I'm doing is I'm working on this herniation back here. And you could see just how all that gold color there is all osteophytes, bone spur, calcified, herniation, and inflammatory tissue. It's just a bunch of crud that shouldn't be there. And it's all closing on his nerve over there in the foramen. This technology you won't find anywhere else. The Deuk laser disc repair is unique to Deuk Spine Institute. You haven't figured that out yet. This patient did not want a fusion. He could have had a fusion done. I don't think he's going to need one, but I've never had one of my surgeries not work. But there's always a first time, and I don't think that's going to happen for him, but it could. Everybody knows there's a small chance the surgery won't work, and they sign up for it knowing that. It's called informed consent. I think this is going to work, though. We're getting a lot of herniation and bone spur and scar tissue that's compressing the nerve root. We're getting a lot of that out. So the laser fiber is actually a glass fiber. And if you've never seen these fibers made, it's a pretty cool process. They're actually made by dropping a ball of hot or hot liquid glass from like a tower straight down. And it stretches the glass and makes a long, skinny glass fiber. And now, most of this glass fiber, the really high quality stuff, is used for fiber optic communication, like, you know, the internet, underseas, under the, across the English channel and things like that to Europe. But some of this is used in applications like medicine, like we're using it, where we need to transmit laser energy from the source, that machine I showed you a minute ago, to the patient's disc. Or lasers are also used now in kidney surgery, right? Or kidney stones and other types of stones, because they blast those stones and basically break them up. That is the neuroforamen there. Let's turn. Are you able to see, Luis? Normally you put that for you to see, right?
Yeah, well, I do it on bilateral approaches.
Uh.
Yeah.
Well, in the future, you can have that one for you. Like that one there.
But you always look on the top?
I look at the top one.
Oh, okay, so okay.
Yeah. I look at the high def. It's a much better monitor. So, for me, I look at the top one. For some reason, I have better resolution on the ceiling mounted monitor than that one. So you can use that one. Let's see. So I'm doing a technique here where I'm actually pulling backwards with the tube, going back into the disc, deeper into the disc, away from the herniation and the nerve root. And then once I open it up to the side here, like I'm doing now, then I'll come back in and remove all this stuff pushing on the nerve. We've got 5 minutes probably left. I think I have an irrigation issue. I think we're out of irrigation. We're getting a fumarole. You always know when you run out of irrigation because... No. There's not enough. So you can always see the bleeding, and I call them fumaroles, because if you know what a fumarole is on the bottom of the ocean, it's like a thermal vent. But look what happens when you get good irrigation, proper irrigation. You don't see them. And that's what I want, proper irrigation. Makes a difference. Now this is a bone spur sitting on top of his nerve. Huh? Yeah, it's better. Uh-huh. Thank you. All this junk has literally just cluttered up the foramen. Diego, why don't you run a video on how the Deuk laser disc repair works, the animation for our guests.
Okay.
annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
That right there is the nerve root, right there, that white thing. And I've taken what I can from it. This is bone here, and I want to try to get rid of as much of the bone spur as I can. I'm going to flip and go the other way, but we're pretty close to being done. I feel like we've gotten everything we can safely off of the nerve root endoscopically. I feel pretty happy. I don't see any more herniation. I'm going to try to focus this a little bit better. Watch the fiber on my face. A lot of scar tissue right here. A lot of scar tissue. That's what I was working on earlier. That's all scarred up posterior ligament, posterior longitudinal ligament. And the more I can debulk it, the more I can get the pressure off that nerve. I feel like I've taken as much as I can safely. I don't think there's much left. So let me just look one more time out the foramen, and we're going to be done soon. Again, I saw my technique. I pulled backwards, and then I came in and I go down onto the bone spurs and calcium. Look how nicely the laser vaporizes all that. Very, very bad stuff, you know? Come down and look. This is all arthritis. Really severe arthritis. All right, well, I feel we've done everything we can. We're done.
Lights on, please. Scope off, please. Thank you.
This was a tough one because the access was difficult. You know, getting down to the actual disc because of his very thick shoulders and high collarbone. But we were able to do it through a modified technique of crawling along the front of the spine with the tip of the dilator. So I was able to get down safely to the C6, bottom of the C6 vertebral body, where there was a bone spur curving down over the front of the disc, but not completely blocking the disc at all. It still left an access underneath the bone spur, but I was able to get the needle to that, then the guide wire, and then I put the dilator on that bone spur, and I just marched the dilator down a few millimeters until I was over the actual opening in the disc in the front. All right, let's see what we've done here, Diego. Can you see?
Yes, we can.
This is his face, his neck, his Adam's apple, his shoulders and chest here. I'm going to take this fluid adapter off so you can see. The whole surgery was done through this tiny little tube right here. You see that? Diego, I don't hear you.
Yes, we see it.
Yeah. And then I'm going to take this tube out. Okay? And then we're going to put some pressure. And we're done. I will show you the incision. It's just 4 millimeters wide. It's tiny. This is an amazing system that Wolf has developed for these surgeries. Wolf is the German company that makes the scope. And that's the system that I use. Very ingenious. However, unfortunately, there's just not a lot of spine surgeons that have adapted this technology, even though it's very advanced. And the reason is it's hard to do. This is a very hard surgery to do, technically, and it requires specialized equipment. And he's bucking a little bit, Doc. I don't know if you can just get him down for another couple of minutes while we put his bandage on. Yeah, he's going down. He's just gagging. So because I'm putting pressure right here on his trachea, you know, if you put your finger on someone's throat, they're going to gag. That's all he's doing. We want him awake, but we don't want him awake just this moment. So we're going to put him to sleep for a couple of more minutes while we put his bandage on, and then we can wake him up in a controlled fashion. All right, so Diego, you want to see this incision?
Yep, we're zoomed up.
You guys ready? Look at this thing.
Yep,
You can't even see it. It's like closed itself.
there it is.
There. Basically 4 millimeters. 1 drop of blood we lost. There's 20 drops of blood per milliliter, so we lost 0.05 milliliters. It's basically bloodless surgery. We lose more blood putting the IV in. The nurse is like, no, I got it in. No. So it's a competition between how much blood do you lose in the IV versus how much you lose in surgery. It's so little. There's no need for blood transfusions. There's no bleeding. This is an outpatient surgery. This patient's going home in an hour. There's no hospital stay. It's done completely outpatient in our state-of-the-art spine surgery center at Deuk Spine Institute. The patient will wake up and he literally will go home very, very soon. And by tomorrow, he'll be back to a normal life. Hopefully this works for him. All right, I'll come over there and answer questions. So go ahead and run a video and I'll be over there in a few minutes.
Causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, 2 patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a ½ inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, The laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
good to go.
Dr. Deukmedjian, I'm here wrapping up the surgery that you've been watching. This patient presented to me with not so much neck pain. He had neck pain in the past, but kind of let it go, worked through it. But now his arm was going dead, his left arm. He really couldn't even lift it up. I mean, he is losing complete strength in his arm. We looked at his MRI, and he wanted to fix the one disc that was the worst, pinching the nerve. That was the C6-7. And when we got in there, you can actually see in the footage going on behind me during the surgery that there was a lot of collapse of the disc, degeneration of the disc with spinal stenosis, cervical spinal stenosis. That was happening in the left foramen, and it was not a soft, fluffy disc that was pushing on the nerve. It was calcium, bone spur, scar tissue, herniated disc, and inflamed annulus. So it's a combination of a bunch of stuff just wadded up, pushing on the nerve root. Now I got that nerve root completely decompressed, and hopefully the nerve will make a recovery. The problem is, folks, if you wait too long, that disc just collapses and gets all bone spurred up and scarred up, and it becomes a hot mess. It's very hard to really deal with and fix. It's kind of like, okay, you got a scratch on your car, right, on the paint. You can see the metal underneath. Now, if you just get it in right away, you clean it, you buff it, you paint it, you get a paint in there, you know, and you prevent the rust from getting in there and spreading. Then you're going to be able to preserve your car. However, if you neglect it and you leave it alone, then you're going to get water, and it's going to get oxidization of the steel, and you're going to get rust. And pretty soon you're going to get all these bubbles, and the paint's going to start flaking off, and the whole car will rust out. So the point is, you want to get to a problem early and get it fixed early. There's no difference with herniated disc. It is a tear in the back of the disc that allows the jelly to squeeze through the tear, and it creates this massive inflammation going on in there. And that's why you have pain. If you just ignore it, don't do anything about it, it's just going to get worse. So I recommend people get these things, their herniated disc, fixed early before they degenerate the whole disc and the disc collapses. All right, do we have any questions?
Yes, we do. We have a question. It is, I was told that I need my neck fused. And I don't know, I've been watching your videos. What makes a good candidate for this?
So the question is a very good one. Comes from Facebook or YouTube?
Facebook.
We have a Facebook viewer. Name?
We have call him Leona.
Leona. I believe Leona has asked from Facebook, hey, I've been told that I need a fusion on my neck, but this looks better. Of course, it is better. And how do you know if you're a candidate? Anybody that's been told they're a fusion is a candidate for this surgery. You don't need to get the fusion. I've done literally 1,000 fusions on people's necks before I started doing endoscopic surgery, and of course overlapping with some endoscopic surgery. Fusion was all I used to do because it works so well. When you do a fusion, if you do it right, it works great. However, it's going to create a lot of scar tissue down there. You won't be able to see it, but you'll feel it. And it will affect your voice permanently. It will affect your ability to swallow as well. The scar tissue from a fusion and the metal plate that's put in there are literally going to be there the rest of your life. They're permanent. You can't go back and take them out and fix the problem. Even if you take the plate out, you still have the bones fused together, so you've lost that movement. Just to understand what I'm talking about, let's take a look at a normal spine. All right, you got bone and bone. We call these vertebral bodies. So let's just say this is C5 and this is C6. And between them is the C5-6 disc. It's like the buns on a burger with the meat patty is the disc, all right? Now the bones are not flexible, but the discs are. You see that? And you can go side to side, you can go front to back as well, and you can also rotate just a little bit. Rotation is pretty much limited, though, in the spine, and it's limited by the joints in the back of the spine. These are called facet joints. So if you want to move side to side, your facet joints basically bang on each other. So really, you've got about 2 degrees of rotation at each segment. When you add up all the segments, there are 7 of them, plus you have the C1, C2, which allows 50% of the rotation of your spine. You actually get a pretty decent amount of rotation, but only about 2 degrees at each segment. Point is, when you fuse bones together with the cage and the metal plate, okay, that's what it looks like. You've got a metal plate and you've got cages. You can kind of see them in there, right? The little cages in there, right there and right there. This is an ACDF, 2-level, okay? 2-level, you know, whether it's C4-5, 5-6, or C5-6, 6-7, doesn't matter. But that's a pretty big plate to be behind your swallowing tube by your voice box the rest of your life. Plus, you lose the movement, all right? So the rest of the spine moves, but that fuse segment doesn't move. Why would you put yourself through this barbaric, old-fashioned surgery, ACDF, or even artificial discs? Because they're very invasive, cause a lot of damage from the surgery itself. You could see with the Deuk laser disc repair, we don't make a big incision. There is no scar tissue, there is no metal plate, there is no artificial disc. It's all natural. It's just go in there and repair the tear that's causing all the problems. Now take a look here. Come on back to me for a moment. Can you see the tear in there in the back of the disc? Yeah, right there. You got it. That little red tear. Now watch what happens when you lift something. It puts pressure and it squeezes the jelly out. And the jelly comes out and hits nerves, okay? What I do with the laser surgery is I go in and I clean that tear and debride it. By debriding that tear right there, I go in with the laser through the front and I get to that tear and I remove the herniation, I debride the tear. Can you all see that? There's the tear there. I literally go through and debride it like the video shows. By doing that, we're able to get rid of your neck pain, your headaches, and your arm symptoms. Pain down the arm, numbness, tingling, weakness. That's what we treat. We treat it, but without doing a fusion or an artificial disc. All that's unnecessary. The only people that benefit from fusions and artificial discs are the companies that make that metal and sell it. They make billions of dollars a year selling metal. And the other person that benefits is the spine surgeon because they get paid a lot of money to put that metal in. If you don't believe me, look up the instrumentation codes and see what they're paid. When you get your EOB from the insurance company, it'll break down all the codes and you'll see how much money they make from putting metal in. It's a lot of money. So it's totally unnecessary. You, the patient, are the recipient of this unnecessary treatment. So it's time for people to know the truth. You don't need metal in your spine to fix your herniated disc or your bulging disc or even your degenerated disc. We can do it endoscopically, but there's only a few surgeons in the world that know how to do it. And in the United States, it's in Florida at the Deuk Spine Institute. We are on the Space Coast near NASA. And you're going to have to come into Orlando and come here to get it done. But that way you avoid the fusion, you avoid the metal, you avoid all the complications.
We have another question, Dr. Deuk. You also perform endoscopic cervical surgery from a posterior approach?
Do I also, so the question is from?
This is Hugan on Facebook. Hugland.
Hugland endoscopic, of course. You know, shame on you guys, first of all, because you should be more supportive of endoscopic surgery in the United States and promoting it through surgeons like me, you know. Anyway, do I do a posterior endoscopic approach? I can, I don't. Why? Because it's worse. So what this person is asking is, remember we said there's a herniated disc, right? And I'll show you. Let's use this model right here. This is a better model, okay? All right, you see the herniation here coming out of the tear right there. Can you all see that? Hopefully you can see it. Can you point to that, Diego? Right there, okay? So there's two ways to treat this. There's one way that's good and the other way that's absolutely horrible. We go through the disc. It's called trans because you go across discal, transdiscal. Whether you do an ACDF or you do a artificial disc or you do a Deuk laser disc repair or you do an endoscopic discectomy, which is what the Koreans do and some of the Chinese are doing now. You go through the disc with an endoscope, you remove the herniation. What they're asking is, do you ever go in the back of the spine and remove the herniation this way? The problem is there's this bone there and this joint. So the only way you're going to get to the herniation is if you drill away and remove this bone. Well, why would you want to take a naturally stabilizing bone in your body out? That would be like removing a third of your house in order to come into your house when you could have just gone through the front door. You don't want to remove structural elements because they stabilize the spine. The only way to get to the disc through the back is to remove this bone. So no, we don't do destructive procedures like posterior endoscopic foraminotomy. It's a useless procedure. I don't recommend it at all. I've never done one. I've been successful at treating herniated disc and spinal stenosis through an anterior approach my entire career for 15 years. The only people that go posterior through the back and do endoscopic foraminotomy are people who don't know how to go through the front. The people who go through the front know how to go through the back. We choose not to go through the back because it's a far worse surgery for the patient. The patient is going to end up with instability, and then they're going to need a fusion as a result of that surgery. So I don't agree with that approach. I think it's a bad approach. I know how to do it, of course. I choose not to do it because it's a far more destructive approach.
All right, now we have the last one. This is very special. He's responding to Leona. Says, hey, I had surgery 48 hours ago by Dr. Deuk at C5-6 and 6-7. I was told fusion was my only option. I found Dr. Deuk and I am now pain-free. So grateful for saving me from a fusion as he spent so much time trying to fix bad barbaric fusions. Get laser done. Al from Ontario, Canada.
All right, so there you have it. One of my own patients who was here just 2 days ago having this similar procedure that we just watched. He had a 5-6 and a 6-7, and his surgery went really well. We broadcasted. You can go back and watch it a few days ago. Deuk laser disc repair on our YouTube channel, C5-6, C6-7. That was his surgery. Well, thank you for watching and commenting. Yes, you're right. Don't get a fusion. Nobody needs a fusion. Nobody needs an artificial disc. Those are absolutely 100% unnecessary surgeries. The Deuk laser disc repair endoscopic is the way to go. You can come here to Orlando and have it done safe and effectively. There's plenty of literature to support it. We've published it. It's my surgery is now published in textbooks, and so it's been double peer-reviewed and double published. Everything we do is FDA approved, so it's safe, and we've never had a complication doing any of these surgeries, and 1,400 from the surgery itself. So patients love it, and it's a 1-hour recovery, and you're back to your regular life within an hour. This is absolutely the truth. I hope I can save people from having unnecessary metal put in their spines, but I also hope the people out there that have been told there's no treatment, there's just medication, there's psychology, fibromyalgia, all of that is nonsense. Let me tell you something, folks, about fibromyalgia, and I want to say this for the record. I have been performing spine surgery, and I have been a spine institute, meaning virtually 100% of the patients that come here are spine patients with back pain and neck pain, 100% to Deuk Spine Institute, okay? Of course, I'm a neurosurgeon, so I do brain surgery as well. I do peripheral nerve entrapment, carpal tunnel release, ulnar nerve release. I do all the neurosurgical stuff, but for the last, 16 years, it's been spine pretty much every day. And we have 100,000 patients in our database that we've cared for, 100,000 patients. Do you know how many fibromyalgia patients I've seen in 100,000? Yeah, 0. Why is that? Because fibromyalgia is a diagnosis of exclusion. What it means is these doctors can't figure out what's wrong with people, why they have pain, so they say it's fibromyalgia. What they're really giving that patient is a lifelong sentence of a disease that can never be cured. And they're basically telling that patient, when they give them the diagnosis wrongly of fibromyalgia, that they're going to have to take pain pills the rest of their life. Now, this fibromyalgia diagnosis blew up in the 80s and 90s, and doctors were calling everybody with chronic pain fibromyalgia. And guess what happened to all those patients they labeled with fibromyalgia? They started taking oxycodone and OxyContin, and they became drug addicts. They lost their jobs, they lost their relationships, they lost their lives. 80% of The heroin addicts on the street today in the United States were chronic pain patients diagnosed basically with fibromyalgia and other diseases that could not be cured. And they basically, lives have been destroyed. And that really, really bothers me to no end. And that's why I do what I do here at Deuk Spine. I cure back and neck pain because it can be cured. And people don't have to live with it. And that's the most important message that could get out. Don't give up on life. Don't give up because your pain is curable. Don't believe the people that say it's not. Don't believe the people that tell you you have to have metal or artificial disc, because they're just trying to make a lot of money off you, and they're going to make you have to have a surgery you don't want. Trust me, if you knew better. And that's why we broadcast, so people can learn the truth. Any more questions? All right, we're going to do a newer procedure called an endoscopic laser rhizotomy for lumbar facet pain in a patient who has bilateral L4-5, L5S1 facet joint arthritis and pain. We're going to broadcast that surgery so you guys can watch. That'll be next in about 30 minutes.